Healthcare industry is an area where job openings are plentiful, but it's having a very hard time finding good candidates, especially when it comes to nurses. The shortage is getting worse. Hospitals in the U.S. face a very big challenge. Hendrik Sybrandy has this.
At Spanish Peaks Regional Medical Center in Walsenburg, Colorado.
Some days can be extremely slow, and then there's days that are very chaotic. It's unpredictable.
What's quite predictable is the fact they simply don't have enough nurses.
I think there's probably about 3 or 4 positions that are open right now.
Walsenburg is a town of just 3,000 residents, which doesn't help with recruitment.
Trying to find somebody that's willing to move to a small community that doesn't have a lot of resources, that's a challenge. We sometimes have a little more revolving door than we would like.
It turns out Spanish Peaks is far from alone. A new study from the Georgetown Center on Education and the Workforce projects that while the U.S. economy will add 1.6 million jobs for nurses in the next 5 years, that'll still leave a shortage of nearly 200,000 nursing professionals. To care for America's aging baby boomers and millions of people who've just signed up for health care.
Here is one of our mannequins, one of our high-fidelity simulators.
The dean of the Denver School of Nursing says a severe lack of qualified nursing instructors and lack of clinical sites where students can get hands-on training account for a lot of the current shortage.
If they go to a clinical site that has obstetrics, our students aren't guaranteed that they're going to see anything. There might be women in labor. There might not be women in labor.
Meantime, some veteran nurses say hospitals are assigning them more hours and patients rather than adding staff.
I think they're filling what their budget will allow.
Correlates with IPS.
Spanish Peaks' chief nursing officer says her younger employees complain about new medical equipment and regulations.
They're really telling themselves, is this the profession that I want to get into? There's so much stress anymore.
Kate Miller, an operating room nurse at Denver Health Medical Center, still loves her job.
It's incredibly rewarding, incredibly hard.
She thinks of her colleagues who will be retiring as she helps her hospital recruit their replacements.
We're going to lose a lot of very experienced, knowledgeable nurses. It's a scary thought.
And a complicated challenge in a field where demand for nurses far exceeds supply.
I don't see any light at the end of the tunnel in the foreseeable future.
Hendrik Sybrandy, CCTV, Denver.